Hi, my name is Lori, and I'm doing a presentation on social media and healthcare. There are conflicting views on the use of social media regarding physician and patient interaction. Social media submission in healthcare is the usage of tools such as Facebook, LinkedIn, Twitter, blogs, video, photo sharing sites, and Google Plus for networking and education to improve specialized networking for patient care and public health programs. According to Ventola, a survey found that 90% of physicians use some form of social media for personal activities. Social media sites have an assortment of different features to serve different purposes for individual users. Informatics is changing significantly within the scope of healthcare, manifested in better quality outcomes. The decrease in errors is a result of higher quality and safer care by coordinated teams who document in the electronic medical records. Balancing the practice of social media communication is imperative as it connects to the role of health informatics in growing patient visits, which is a central goal in contemporary healthcare. Therefore, experts can overcome these hindrances to advance the involvement of patients and inspire engagement. Patient-centered attention is reinforced more and more by the connection with social media, including mobile skills and the network. Patients can profit from disease self-management paraphernalia, closer monitoring, and exchange with others. The use of these technologies assists researchers in studying drug effectiveness or recruit patients for quantifiable training. However, ethical matters can arise from low communication blocks in social media, safety problems, and inadequate confidentiality. Ethical issues need to be addressed in social media when winning healthcare settings. Confidentiality and privacy of online handlers is a primary concern, and the issue of information usage. Physicians need to safeguard healthy boundaries among qualified and isolated material. The exploitation of data needs to be prohibited. There are many laws, regulations, and voluntary standards relevant to the use of social media in healthcare, which include the 21st Century Cures Act, implemented in 2016 by President Obama, the Privacy Act of 1974 by the federal government permitting citizens to know data that is collected on them. Another example is alcohol and drug abuse patient confidentiality, which protects patient information collected on patients along with their treatment. The Joint Commission on Accreditation of Healthcare Organizations, also known as JCAHO, is another private association associated with Medicare. HITECH Act is another organization that assures the privacy of information with health IT info. HIPAA laws also protect the privacy of patient information. The Affordable Care Act of 2010 assists patients with lower health care costs that are affordable to patients. Social media in healthcare has impacted many aspects of the healthcare delivery system. The fluctuations have warranted aggressive changes in the need for more advanced technology. Physicians have advantages with gathering information, management of patient information, clinical decision-making, and medical education and training. Though there are many benefits to social media use in healthcare, there are concerns to safety standards of apps used with these benefits. There are safety measures in place to assist with barriers in the app market to increase the quality and safety of the usage of the current app. Administrative data usage is important when it comes to data sharing in the healthcare field with healthcare professionals. A barrier to administrative use are laws that restrict data sharing between provider offices. Therefore, lawyers are consistently working to change laws so that the law is an indispensable means versus an obstruction to the flow of data among healthcare fields to sustain patient healthcare. Social media in healthcare creates the need for education and research, especially relating to HIPAA violation laws. There are laws enacted since 1987 that protect patients with HIV and substance and alcohol issues that require privacy and confidentiality laws in place. These laws protect patients in the context of data usage and sharing. Social media data capture tools and technologies assist with timely care and efficiency in patients' healthcare delivery. With the rising cost of healthcare delivery, using social media in the process can help cut excess and wastefulness that subsidize to the mounting healthcare disbursements. Social media apps using cell phones can significantly cut costs over time, paper usage by sharing patient data between facilities and patients, so proper research and laws need to be implemented. The combination of data challenges within the scope of the healthcare field and patient information, such as at the time of registration of patients' demographic information and privacy information, can create trials when it comes to information needing linkages across networks for healthcare delivery. The importance of educating all those involved to assist in creating a healthcare system with effective social media application is imperative. In the final analysis, with all the conflicting views on social media and physician and patient information sharing, it is important to have laws in place that protect privacy and confidentiality. Training and education on the use of tools for self-management and patient interaction are imperative for the implementation of quality healthcare. Researchers are involved in this process to study and quantify training of proper healthcare strategies, the enactment of healthy boundaries among qualified stakeholders so there is no misuse of data is essential in this process. Social media laws and regulations and the healthcare transformation of information in the 21st century are important for quality healthcare. Ultimately, safety measures in healthcare, social media usage help cut increasing healthcare expenses and carelessness in healthcare expenses.